it may come to as a surprise for you or not, that there's thousands of people like me with disabilities that are wondering, how do you plan to lower the cost of healthcare? Because the stuff I use, it costs me about $1,500 every 3 months. It's killing me.
Yep. And it's insulin.
Insulin, and then I got a insulin pump and a sensor.
Okay, so insulin, as you probably know, and by the way, I empathize with you on your situation. I have MS. I know chronic health issues. It is not fun. They all manifest differently, but none of them are fun at all. Insulin, the drug that you need to live, that costs you, what did you say, $1,500 every 3 months? So you're paying $500 a month for a drug that has been around longer than anyone here has been alive. And in most countries, it's a generic that's sold for next to nothing. Do you know why you pay so much? It's because of that as well. But the biggest reason specifically for insulin as well as epinephrine, you know why EpiPens, which the active drug in it costs pennies to make and the machine itself costs a few bucks to make? Do you know why these things that are life-saving things cost so much? Because these companies have patent protections for drugs that have been around for decades and in some cases over a century. The government has told anyone else who wants to make insulin or epinephrine or any of these drugs that are generic almost anywhere else on earth, you can't make that. This company has a patent protection on it, so we'll go after you if you try to make it. And then that empowers these companies to charge whatever they want. You know why? Because you're not the one often who has to pay for it. It's the insurance company that has to pay for it. It's Medicaid and Medicare that has to pay for it. And for the rare chance that there's someone who just doesn't have coverage for some reason, they can just die. That's how they look at it. And I hate to put it in those kinds of terms because I know how real that is to you, because I know how real my issues are to me. But the people that are in charge and the incredibly cynical, powerful people who sponsored them to be in office do not care if you die. And they do not care how much more expensive the cost of healthcare gets and the cost of pharmaceuticals get, because they become wealthy in the meantime, and then eventually we'll get so sick of it that the government will be able to convince us to just take over the whole thing. And guess who will be in charge of it? Them. The same people who said, you die if you can't afford insulin, and no one else can make it, even though it's been around forever and everyone knows how to make it, that's in pharmaceuticals, and no, you can't go to another country and buy it for pennies on the dollar and come back here with it unless you want to get arrested and put in jail for violating a federal crime, and no, you can't find some other way around it. They're going to decide whether you even get health care or not. The answer, Joe's answer, is to get government out of health care. I was talking before about the COVID-19 pandemic. During the time of the pandemic, the first 2 months that it was here, companies were making test kits here in the US and selling them overseas because they weren't allowed to sell them here. Because the CDC said, no, we got to make our own first. And even though these test kits are easy to make, turns out the government sucks at making anything. So they spent nearly 2 months before they finally went, okay, fine, we're never going to be able to do this. And meanwhile, you had doctors illegally testing people for COVID, making their own test kits, which were 90+% reliable. And when they went to the CDC and said there are already people here who have COVID-19, the CDC, the Centers for Disease Control, that the Republicans created supposedly to protect us from this very type of outbreak, their initial response to that was to say, what you did was illegal, destroy those test results, do not tell them they have COVID, send them home. And we think that those people, the people who imposed a pandemic on us back during the time when it could have potentially been contained, that they're going to be good at giving us health care. The answer is to get them out of it. The answer is to get the red tape out of it. The answer is to get the patent protections out of it so that the price equilibrium happens and so that you and your providers decide what you need. Not bureaucrats, not politicians, and not cronies. They decide what you need, and you can get it from whoever is able to provide it to you, instead of with all of these protections and red tape and barriers. That reduces the cost of healthcare. More importantly, specifically for you, it reduces the cost of your pharmaceuticals. And I hope that answers your question. Thank you.